Hi, I'm Najamul Ansari, and I'm part of the TriHealth Heart Institute. So interventional cardiology is one of the subspecialties of cardiology, and basically it's where we are acting as plumbers within the heart arteries. We take clogged arteries and open them up, usually with balloons and stents with a technique called angioplasty. So we do a lot of work with preventative cardiology, which is the actual start point, and actually one of the passions that I have is to work with patients so that we actually prevent them from ever having to undergo a procedure. But also during the procedures itself, we are actually an extremely experienced cardiac center, and we do a tremendous amount of volume as far as patient angioplasties and just general procedures being performed. My main focus is try to not have to do procedures on patients, but when I do have to do procedures, a lot of times we can take patients who are oftentimes experiencing a heart attack, for instance, or having one of the worst days of their life, and very, very quickly we're able to treat that condition, fix the heart attack, and have them up on their feet within a few hours. And they go from having a tremendous amount of chest discomfort and issues into actually feeling pretty well and actually being relieved of what was bothering them. The biggest change to interventional cardiology is with the addition of structural heart therapies. And this is where we can actually replace entire valves in the heart through the groin, through these very same minimally invasive procedures. The second change that we've really seen is that we're doing a lot of our procedures through the wrist. And so whereas before, when I first started my career, we would be doing every single procedure through the leg arteries, and patients would have to recover for a fairly long amount of time, flat on their backs, usually about 6 to 8 hours. Nowadays, and within 30 to 45 minutes, we usually have patients up and walking around, usually with a cup of coffee. So I think one of the biggest unique characteristics of the TriHealth Heart Institute actually is our diversity. It's the fact that we have cardiologists and cardiac surgeons who have both trained and practiced all around the country. And they bring different viewpoints because of the fact that they've lived in different parts of the country and they come from different backgrounds. I think the first thing that I would tell a patient is that both within the Heart Institute and TriHealth in general, and I think being a physician, the most important thing that they should know is that we value the patient-doctor relationship and that we put the patient first in that. We take the time to listen to our patients and also to advocate for our patients. And that may involve several different aspects of their care, all the way from prevention to treatment. It may involve tests, and it may involve procedures being done to them. But we always want to match the right patient with the right tests and the right procedures. And they should take comfort in knowing that.